Hello, and welcome back. Today, I am going to talk about vaginal bleeding in pregnancy and what you should do if you experience this. Please don't forget to share our videos with others that may benefit from them. Vaginal bleeding or spotting during pregnancy is quite common, and it does not always mean that there is a problem with the pregnancy or risk of a miscarriage. However, in some women, it can be a sign of something dangerous or serious. There are several causes of vaginal bleeding in pregnancy. One of the common causes of bleeding in pregnancy is implantation bleeding, which occurs when the developing embryo implants itself in the wall of the womb or uterus. This can cause some harmless light bleeding called spotting. This type of bleeding often happens around the time a period would have been due to take place. The implantation bleeding is usually very light and lasts a few hours. There may be light cramping with the implantation that lasts a short period of time. Implantation bleeding usually occurs about 6 to 12 days after conception, and this would generally be around 1 to 2 weeks after sex, depending on the ovulation timing. The other possible cause of vaginal bleeding in pregnancy is cervical changes. Hormonal changes in pregnancy can cause alterations to the cervix, and this may sometimes cause bleeding, particularly after sexual intercourse. More serious causes of vaginal bleeding in pregnancy are miscarriage or ectopic pregnancy. These usually happen during the first 12 weeks of pregnancy or first trimester. A miscarriage is classified as a loss of pregnancy before the 24 weeks of gestation. The definition of miscarriage may vary from country to country. Miscarriage accounts for around 1 in 5 pregnancy losses. Many early miscarriages before the 12 weeks of gestation happen because there is a problem with the development of the baby. The other causes are chromosomal disorders, hormonal imbalances, and medical conditions such as diabetes and clotting problems. Most miscarriages occur during the first 12 weeks of gestation, and it is not possible to prevent them. A miscarriage usually presents with vaginal bleeding, blood clots, discharge of fluid or tissue from the vagina, followed by cramps and lower abdominal pain. Ectopic pregnancy is when the pregnancy takes place outside the uterus, such as in the fallopian tube. This is usually considered a medical emergency as it can cause serious complications because the embryo cannot develop properly outside the uterus. This is treated with medicines or surgery to remove the embryo before it causes serious problems. The symptoms of an ectopic pregnancy usually occur between 6 to 8 weeks of gestation but can happen later. The common symptoms are vaginal bleeding, brown, watery discharge, lower abdominal or pelvic pain, shoulder tip pain, and discomfort when going to the toilet. It should be noted that if vaginal bleeding occurs in the first trimester and the pregnancy ends, this should not prevent a woman from having a successful pregnancy in the future. If the bleeding is mild and it stops quickly and there are no other symptoms, treatment is not usually required. If there is a history of previous miscarriage and if the pregnancy has been confirmed with a scan, a medicine called progesterone can be considered to stop the bleeding in early pregnancy. This medicine is taken twice a day until 16 weeks of gestation. Vaginal bleeding in later stages of pregnancy is not common. However, if bleeding happens, this could be due to cervical changes, vaginal infections, low-lying placenta called placenta previa, or placental abruption where the placenta starts to come away from the wall of the uterus. It is advisable to see a doctor or go to the hospital if there is unusual vaginal bleeding, abdominal pain, pain at the tip of the shoulder, vomiting, dizziness, urinary symptoms, or other concerning issues. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first. Images and animations in this video are only for illustrative purposes.